quality of care. And then, of course, in the National Physician Service Corps, they'll be spending a lot of money. Another place where there's going to be significant potential money available for safety net clinics is the fact that nonprofit hospitals are going to be very carefully inspected to make certain that they deserve to be nonprofits because they're doing so much good in the community. I think the hospital will be happy to give you some new support. There are going to be some surprises in healthcare reform. Members of Congress are going to be required to buy their health insurance through the new state exchanges. No illegal immigrants. Chain restaurants have got to display calorie counts. Tanning parlors are going to be charged a new 10% tax, and everybody will have long-term health insurance. You know, I wish we could spend about an hour going over this slide in detail, because this is a really crucial slide. You can't read any of it, can you? Sorry. But it shows that President Obama is right. We really can significantly reduce healthcare spending. But we've got to do all these things. We have to improve inpatient care efficiency. We have to use lower cost treatments. We have to quit having so many complications. We have to have adverse events and readmissions to the hospital stopped. In all these things on the bottom that primary care is going to do that makes primary care a true medical home. I'm sorry, we need to hasten on. And then they're talking about bundling services so that hospitals and surgeons can share a joint fee that will be paid by the government. Here's a medical home. I guess I can't overemphasize the importance of medical home to you people. I know that one of the biggest challenges for your clinic is to be able to qualify as a medical home. I think you really are going to have to put resources into investigating what that means for you and what you're going to have to change to really meet the definition of a medical home. We put all these things together, and what we have is an accountable care organization. Ooh-wee. Get ready for accountable care organizations. Which accountable care organization are you going to be part of? Here are the basic rules for Medicare accountable care organizations. You have to agree to participate for 3 years. You have to have 5,000 patients and enough primary care docs to take care of them. You have to meet all these other criteria. But now is the time to look into how you're going to qualify. Eventually, we anticipate that there will be, I'm sorry, my slides aren't keeping up. Eventually, we anticipate that there will be different kinds and levels of ACOs so that there will be different combinations of physicians, and payment arrangements are certainly going to change once the accountable care organizations are established. And I think this is really a key slide as far as the way healthcare is going to look in the 21st century. We have to do these 4 things. We have to have an effective system of communication and coordinating care. We have to continuously improve, and you have to be able to generate the data that proves that. We have to use standards, and we have to monitor performance, and finally, we have to prove that we are of value within our community. So better care means that we have to have information, there will be incentives, things have to be coordinated, there does require management and leadership. We have to engage our patients in making decisions, and then there needs to be employer buy-in to force multi-payer cooperation. So